Let's talk about the must-have vaccines every pulmonary patient should know about. Living with a chronic lung condition means paying extra attention to your health year-round. Breathing is something most people take for granted, but for patients with asthma, COPD, or other respiratory illnesses, even a minor infection can turn into a major setback. That's why vaccines play such a critical role in protecting lung health. If you or a loved one has a pulmonary condition, here are the essential vaccines you'll want to keep on your radar. And don't worry, we're leaving COVID off this list so we can focus on the other equally important ones. Number one, influenza flu shot. Every fall, flu season rolls in, and for people with lung disease, the flu can lead to dangerous complications like pneumonia or worsening shortness of breath. Annual vaccination is recommended because flu strains change each year. Think of it as a seasonal shield that helps keep your lungs out of harm's way. Number two, pneumococcal vaccines. Pneumococcal bacteria are a leading cause of pneumonia, meningitis, and bloodstream infections. For pulmonary patients, pneumonia can mean hospitalization or long-term decline. Two types of pneumococcal vaccines are available: PCV20, Prevnar 20, and PPSV23, Pneumovax. Depending on your age and health history, your provider may recommend one or both. Protecting against pneumococcus is one of the single most important steps you can take to safeguard your lungs. Number three, pertussis, also known as whooping cough. There is the Tdap booster. Many adults forget that pertussis isn't just a childhood illness. A deep hacking cough can be miserable for anyone, but for someone with asthma or COPD, it can trigger severe flare-ups. That's why adults need a Tdap booster: tetanus, diphtheria, and pertussis every 10 years, and sooner if you're around newborns or infants who are especially vulnerable. Number four, shingles, herpes zoster. You might not think of shingles as a lung-related issue, but for older adults or those with weakened immune systems, shingles can lead to complications that stress your overall health, including breathing. The Shingrix vaccine, recommended for adults over 50 and some younger patients with certain conditions, helps prevent this painful and sometimes debilitating illness. And number five, RSV, or respiratory syncytial virus. RSV isn't just a problem for kids. In older adults and those with chronic lung disease, it can cause severe respiratory illness and even hospitalization. New vaccines are now available for adults over 60, making this an important conversation to have with your healthcare provider if you're living with asthma, COPD, or other chronic respiratory conditions. For pulmonary patients, prevention really is the best medicine. Vaccines not only lower your risk of getting sick, but can also prevent hospital stays, disease flare-ups, and long-term lung damage. While every patient's situation is unique, these five vaccines, flu, pneumococcal, Tdap, shingles, and RSV, are worth discussing at your next visit. Protect your lungs, protect your health, and breathe a little easier knowing you've taken steps to stay ahead of the season. If you would like to make an appointment with one of our providers to discuss any respiratory symptoms, we have 5 convenient locations in South Jersey and 1 in Maysville, Kentucky, or you can schedule your appointment online at medcorvsusa.com.